will be centered on the management of dengue. And we know that in recent weeks, I could say recent months, our country has been having an outbreak of dengue fever. And it is not just Jamaica, but even Barbados, another Caribbean country, they also have an outbreak of dengue. We tend to have outbreak of dengue when we have persistent and heavy rains. You know, it causes the mosquito population to go up. And with the poor disposal of things that can harbor water, especially around the home, then it is just a given that you are going to get an increase in the mosquito population. And although it is not all mosquitoes that are implicated in dengue, but nevertheless, all type of mosquito increase in their population. The mosquito, the ones that are fierce, you know, the ones that I'm talking about, the black, big black ones, those are not really the dengue causing ones, although those are the ones that we fear most. You have some that they call Aedes aegypti mosquito. When we get into the presentation, we'll get some more into that. But those are mosquitoes that are produced around the home. They tend to breed in things that, you know, people have around the homes, whether it be vase, flower vase, or some pots, old pots and pans that are thrown away and were not disposed of properly. Those are the places where mosquito breed. In some countries, they have they use technology to help to control the mosquito population. But in Jamaica, we have been using the old method that we have been using for many years. For instance, every now and then you see them go around to communities and they say they are doing what they call fogging. So they have something that can kill the adult mosquito. But when you hit down the adult mosquito, the larva, the mosquito larva, it doesn't take a long time for them to become adult mosquito themselves, and the cycle continues. Just like how we are trying to fight crime by hitting down the known and the big adult criminal. And we are hardly doing anything to stem the flow of children who are becoming delinquent, and you know that they will be recruited in crime. It does use that analogy to say the same thing we do with mosquito management of the mosquito. On the other hand, if we were, I'm not saying that they don't try to, but if we were able to do away with the breeding site of the mosquito, then it would be a better way to manage the dengue situation. All right. All right, so we have some areas of the presentation that we're going to look at. We're going to give a broad overview of dengue. We're looking at the clinical manifestation of persons infected with dengue virus. And when we talk about clinical manifestation, we're talking about the signs and the symptoms that people show when they become infected with the dengue virus. We're looking at transmission of the virus, treatment of dengue, and the prevention of dengue. So dengue, which is pronounced dengue fever, is a painful, debilitating mosquito-borne disease caused by any one of 4 closely related dengue viruses. Dengue viruses are spread to people through the bite of an infected Aedes aegypti mosquito. The mosquito becomes infected when it bites a person with dengue virus in their blood. It can be spread directly from one person to another. And this is the little culprit that we're talking about, the Aedes aegypti mosquito. It is a slim, some appearance of white and black on the body. It is not something that you will easily notice because it is quite fine, and when it bites you, it does sting, but it is not as terrible as the big black mosquito, which doesn't really cause dengue, but it causes you a lot of pain. What is the global burden of dengue? The incidence of dengue has grown dramatically around the world in recent decades, with cases reported to the World Health Organization increasing from 505 to 430 cases in 2000 to 5.2 million in 2019. And we are talking about confirmed cases when they talk about cases for, even in Jamaica now, we have a lot of suspected cases. And there are persons who will get it and recover if they get a mild form of the disease, and you don't know that they have, just like how during the pandemic, the COVID-19 pandemic, some people got mild cases of COVID-19, and because they did not go and get tested, they are not on the statistics that the Ministry of Health talk about. So usually the cases are underreported. They're never overreported because some people get sick and they don't attend doctor. And when you attend doctor and when you get treatment, that it is reported. And apart from that, because mild cases of dengue can mimic other what we call febrile illnesses, or illnesses that cause fever. Therefore, they could be overlooked. For some time, you could have the ordinary flu going on simultaneously with the dengue. Once it becomes severe cases, then they will be able to distinguish, but the mild cases might get lost and get called something else. All right, so the disease, we're talking about the dengue disease is now endemic. We hear them talk about, you hear people talk about pandemic. When you talk about pandemic, it means that it is a large area of the globe which is affected. But when it becomes endemic, that means that you have cases occurring continuously in countries. So you could say that dengue is endemic in Jamaica because regularly we get cases. It don't reach the pandemic level, which would have to go to affect several countries simultaneously. But the disease is endemic in more than 100 countries. In the WHO regions of Africa, the Americas, and the Americas in the WHO, when they're talking about their estimate of disease burden, it takes in the Caribbean as well. And you have cases in Eastern Mediterranean, Southeast Asia, the Western Pacific. The Americas, Southeast Asia, and Western Pacific region are the most seriously affected, with Asia representing around 70% of the global disease burden. Well, Asia might have nearly 70% of the population. So if you look at China and India alone, India has maybe nearly 1.5, China almost in that same region. So if we have less than 9 billion people in the world, and those two countries alone have over 3 billion, and if we talk about the Philippines, Indonesia, and all of those countries that have big population, so you see, it is not by accident while they have over 70% of the global disease burden. But dengue is spreading to new areas, including Europe, and you have explosive outbreaks are occurring. You have local transmission was reported for the first time in France and Croatia in 2010. And imported cases were detected in 3 other European countries. So you know that there is a when it comes to traveling, massive numbers of people travel as tourists. Some people travel to go to work in other countries and so on. So you have a mixing of different population, and you see how the COVID-19 was able to spread wild and fast. And it is stated that, and it is acknowledged that it was first identified in China. But because different countries are having trade, and they're having their people moving from era to era, that is why we call it a global village. It is not hard for one thing to happen in one country, and quick time is spread to other countries. And that is what happened with dengue too. So after feeding on an infected person, the virus replicates in the mosquito midgut before disseminating to secondary tissue, including the salivary gland. The time it takes from ingesting the virus to actual transmission to a new host is termed the extrinsic incubation period. So when we talk about incubation period, it is talking about the time that it takes for the virus to get into the person and for it to start manifest sickness. That is what we call the incubation period. Mosquitoes can become infected by people who are viremic, or people who have the virus, of the dengue virus. This can be someone who has symptomatic dengue. That means you see obvious symptom, or it can also be somebody who is asymptomatic, or they don't have any symptom, but the virus is in them. They don't start to show any sign. And some people have the the virus and they never become symptomatic. But yet they can, the mosquito can bite them and infect them, get infected and infect other people. And the other people who get infected will show symptoms. That can happen. You know that there is a basketballer who, during the time when HIV/AIDS was rampant throughout the world, that basketballer become infected, but he did not show any illness, and until now he's alive and well. He became a billionaire recently, and I'm talking about no other than Magic Johnson. I think he is a case study why he became infected and he did not show any obvious sign. Well, he had signs of that he was infected, but not that the illness came on him to overpower him. And that is the same way some people have dengue. And although they are showing, if you do their blood test, you will find that they have the dengue virus, but they do not become overcome by the dengue. You have some people like that. Human to mosquito transmission can occur up to 2 days before someone shows symptoms of the illness and up to 2 days after the fever has resolved. So the fever can go, but the person still is infectious. And if the mosquito bite the person and bite somebody else, they can become infected. The risk of mosquito infection is positively associated with high viremia and high fever in the patient. Conversely, high levels of dengue virus specific antibodies are associated with a decreased risk of mosquito infection. So when somebody becomes infected, they develop what we call antibodies, which are some protective devices. I shouldn't really call it device, but it is it's something that the body produces that will fight against that strain of dengue. So the thing about dengue, why you can become infected another time, is because you have 4 strain, and maybe the strain that infected you one time, the next time around is a different strain. So if you become infected with all the strains, then you will be protected. The dengue virus will not be able to affect you anymore. But I don't think anybody would want to go through all of that to have it 410. But most people become viremic for about 4 to 5 days. But it can last for as long as 12 days in some people also. But the average is 4 to 5 days. And just to put in this, just like how they say that HIV/AIDS can be transmitted through breast milk. A few persons can become infected. I'm talking the babies can become infected from maternal transmission. So that is from a pregnant mother to baby. But at the same time, this mode of transmission appears to be very low. So just a few cases of mothers will pass it on to their offspring. What are some of the risk factors for dengue? Previous infection with dengue virus increases the risk of the individual developing severe dengue. And severe dengue is the one that can kill, what they call hemorrhagic dengue, in which the blood vessels tend to to get weak and collapse, and you have bleeding under the skin and bleeding in different organs. Urbanization is one factor. You know that urbanization sometimes it causes people to be living closely to one another, especially in unregulated settlements. So, for instance, if you go to Riverton, and I don't want to use Riverton as any case study where we just anything bad happens in Riverton, but there are several communities that they were not planned, and because of that, garbage disposal, sewage disposal, they are not planned, and sometimes they are not disposed properly. So you will have a lot of containers that can be catching water. Those are factors, risk factors for dengue. Population density, and as I mentioned already, human mobility. When people are moving up and down, they get infected, they carry the infection with them and infect other people. Poor access to reliable water source, poor waste storage practices. All these are factors, risk factors for dengue. Let us look at some community risk factors. Population lack of knowledge about dengue control, unsanitary practices, especially poor garbage disposal method, poor sustainable vector control activities in the community. And by sustainable, we're talking about people identifying that water. For instance, a gully could have an area where water is settling in, and nobody really recognizes it. There is a little gully not too far from where I live here. We have a big gully, and to the southern part of where I live, adjoining another community, there's a small gully. Sometimes when that gully become clogged, and you know why it become clogged? Because people dump garbage in it. The big gully that I talk about, you have intelligent people who live near to it. And because of that, the gully is kept clean so that no water really settles in it. And it doesn't have any area that is broken either. So those are some of the community practices that can cause problem for the very communities. Poor garbage disposal, and you know that sometimes you tell people about mosquito causing infection. They say, "I like a mosquito." Sure. I know that causing, and then we come and tell you some other theories where them believe cause it. And no mosquito. But let me say, I will believe what the scientists say more than what the person who doesn't have any knowledge say. For we have proven that when you control the mosquito population, you can control some of these things that are caused by the mosquito. What are some of the symptoms of dengue fever? Symptoms which usually begin 4 to 6 days after infection and last for up to 10 days may include sudden high fever, severe headache, and people talk about pain, behind the eyes, what we call retroorbital pain, severe joint and muscle pain, fatigue. You just feel like you're out of this world. You just feel uncomfortable, as if everything you try to, every position you assume, you still can't feel comfortable. That is fatigue. Nausea. Well, nausea is this feeling where you feel like you want to wrench and to vomit. And it is not a nice feeling, when you want to keep it down, when your mouth full of what they call it now, something the water. And you try to hold it in. Can you imagine? You're in a place where you don't have anything to vomit into. If you vomit, it is going to be on the floor. You're out in the street, you're out, and it just happened to you. I have a colleague that when I went to work today, she has migraine headache, and part of it, she get vomiting. And even in the afternoon when she was leaving, she said she was still vomiting, and that she was not able to drive herself home, because she was quite weak and maybe feel dizzy. So if you're vomiting for a long time, that is one of the things that can help to speed up, death, especially in young children. They are losing fluid. And let me say, fluid are stored in different compartments in the body. You have tissue fluid, and you have extra cellular fluid and so on. So fluid can be drawn from those compartments when fluid in the stomach and in the gut, when those are diminished. So children can become dehydrated quite easily. And with the Jamaican thing where they say they are going to watch it, we're going to watch it and see. Let me say, when a child, especially children, when they start to vomit and you cannot control it, find the health center, find a doctor, find somebody. Go stay and watch it. And maybe I'm talking to the converted, but our people like to watch it. You can have mild bleeding, such as nosebleed, bleeding gums are easily, or it bleeds easily when you're brushing. Those are some of the symptoms or clinical manifestation of dengue fever. All right, so we talk about dengue. So you can have mild, ordinary dengue, and then you can have what we call severe dengue. Warning signs of severe dengue fever, and this is a life-threatening emergency, can develop quickly. The warning signs usually begin the first day or two after the fever goes away and may include severe stomach pain, persistent vomiting. So if people vomiting persistently, that means they're not keeping on anything. The fluid that their body needs to run all the various processes will be depleted. So you know what? If you are vomiting, not keeping on anything, you have to go to a place where they can get fluid into your body by some other means rather than by drinking the fluid. So when we say they have an IV infusion, that is how they have to maintain fluid in the tissues. And that one you will not vomit out for, since it goes directly into the bloodstream and distributed to other areas of the body. You can find blood in the urine, blood in the stool, or blood in the vomit. You are approaching severe dengue, and the person should not be at home at that time. You have to rush and get the person to medical attention. Bleeding under the skin, which might look like bruising to the ordinary person, but when the person who has more experience look at it, they see that there's bleeding under the skin. You can have difficult or rapid breathing. Well, when you have difficult or rapid breathing, it shows that something is wrong, because normally people breathe without it being noticed. When you're breathing, you don't even hear it. But when you start to have rapid and difficult breathing, and they have what they call stridor, the reason why you're having rapid breathing is because the lungs is not able to get air in and out fast enough. And you have severe fatigue, irritability, and restlessness. You know, I see some people when, well, I don't know how many people you have seen, they're near to death's door. They become irritable, so they are no longer able to have a conversation with you. They are restless, just moving up and down, and look somewhat confused. Those are signs of severe dengue. And we're not saying hungry dengue bring on those, but if a person was known to have dengue and start to manifest those things, they should reach, you should rush to reach to a health facility fast, 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 so that the people who are professionals can take over. How do we treat dengue? There is no specific antiviral agent which exists for treating dengue. So the treatment of dengue is what we call supportive care. Patients should be advised to stay well hydrated. I mean, drink as much water as you can tolerate, or as much liquid, whether it be drinks with high value, you know, with protein and so on. But you should avoid aspirin or acetylsalicylic acid or anything containing aspirin drug. The reason being is that it can cause rupture of blood vessel. And brufen is one of those medications that should not be taken. So regardless of how high the fever is, if the ordinary cetamol or paracetamol that is given, and let me say, when people have severe fever, they don't just give it 4 times a day. Sometimes it increase. I've seen situations in which liquid Panadol was given to patients hourly. And apart from that, you put them in I wouldn't say ice water, but cold water to help to bring down the temperature. For if the temperature reaches a certain stage, a certain high level, it can almost cause the brain to be cooked. In a way, the person becomes so confused. So you don't want them to reach that state. So whatever means they take to get down the fever, we are going to use it. All right, we want to look at update on dengue. This is not the latest. I just get it until November 8th. The country has recorded, as on record, 3,147 suspected, presumed, and confirmed dengue cases as of Wednesday, November 8th, 2022. Of the cases classified, 870 are confirmed, and by confirmed, I mean that they have done tests and the result come back positive that they have dengue. While dengue stereotype or serotype 2, 3, and 4 have been identified among the population, dengue serotype 2 remains the dominant strain. You remember in HIV, the COVID, they were telling you about the strain, whether the Delta or whatever strain that was dominant from time to time. Well, the strain number 2, subtype number 2, is the most dominant strain of dengue, which is in Jamaica at this time. At the same time, so this update is just as how I got it, I just take it and paste it here. I don't do any changes to it. At the same time, there have been a total of 9 dengue-related deaths. They say dengue-related because some of them might have died before they were, they were actually tested and proven that it was dengue. And 2, as confirmed, no deaths have been recorded in the past 2 weeks. All parishes continue to observe an increase in dengue cases in 2023 compared to 2022, with Kingston and St. Andrew reporting the highest number of cases, which is 776, for 2023. However, St. Thomas continues with the highest rate. By rate, we don't mean to they have the highest number of cases, but based on the population that is in St. Thomas, they are having 382.5 cases per 100,000 persons. Sorry. Followed by Portland with 221 cases and Trelawney with 160 per 100,000. The highest number of cases continues to be observed in the 5 to 14-year-old cohort at a rate of 360.3 per 100,000 population. And those are statistics that we need to observe carefully. All right, let us look at prevention of dengue. What can we do to prevent dengue? I see something in the chat. Let me see if it was a question. Somebody had said that they were not hearing the sound, but this is a long time ago. What about the sound now? Anybody hearing me? If you are hearing me, let me hear.
It's okay. It's okay now.
Okay, so thank you. So, how can we prevent dengue? We have to stop Aedes aegypti mosquito breeding. For looking for anywhere water can settle, anything that water can settle in. You ever hear them say the only good rat is a dead rat? Well, the only good mosquito, Aedes aegypti, otherwise, is a dead mosquito. So we want them dead. And if you can kill them, it is even better to stop them from breeding. So sometimes people are just callous with the drinks boxes and whatever, the plastic that they drink out of, they just throw anywhere. And let me say, some places where they throw, they can catch water. A mosquito always wants somewhere to lay them larvae, you know, so that they can replicate themselves. No species is going to kill all themselves. For even scorpion, you know that when a scorpion, we're talking about the mother scorpion, when she decides to have children, you know, to have species of her kind, she is literally giving up her life, you know, for the young ones, literally suck her out to death. That is how scorpion replicate. So we must cover all water containers, whether they are potable, and especially the potable water. If you are saving water to water plants and grass and whatever, it needs to be covered. And the containers that do not need to have water, keep them dry. Clean vases regularly. And although there seem a little method, I know nothing so scientific about doing what I'm talking about, but nevertheless, these are the actions that we need to take to prevent dengue from spreading and for the population to become susceptible to it. All right. Fill all tires with soil or sand. Punch hole in tins or disposable container. And you know, they have some adverts telling you how to recycle or how to destroy the container. Drain all areas where there is stagnant water. You know that sometimes with a lot of rain that we're having, you have some areas by the roadside or wherever, that the waters tend to be there for quite a few days that can breed mosquito before it dry up. pour oil in containers with water for non-drinking purposes. If you have to store it at home and you don't have proper covering, and even if you have covering and you think say 1 and 2 mosquito can sleep in, just put some oil on the top of it. Wherever that is, the mosquito cannot replicate because they cannot breathe. The oil prevents them from breathing properly. And that is my story. So we have looked at a broad overview of dengue, the burden around the world, and we have looked at our country-specific issues related to dengue. And if we get an update like today, we know that it will be different from what I just told you about update. But dengue is not an easy thing. It can cause death and it can cause families to mourn. So let us pay attention to it. Thank you. I'm open to questions at this time or comment.